We are solving your paper that was actually given for your batch. So, posterior triangle of the neck is the first essay question, isn't it? So, at the end of this lecture, you should be able to describe the posterior triangle of neck. We will see the contents. We will see common applied aspects. So now, what is posterior triangle? The triangle which is seen behind sternocleidomastoid is nothing but posterior triangle. Okay. Now, when you talk about sternocleidomastoid itself may come as a 5 marks question. That's why I'm discussing many things here in this topic beta. So now coming to sternocleidomastoid, you can see here we have two bones. One is the like manubrium of the sternum, and then we have clavicle. So it is taking its origin from the sternum and clavicle. So to be more specific, sternum, upper part of the anterior surface of manubrium sterni, and clavicle, it is the anterior surface of the medial one third of the clavicle. Now if you see the insertion, it is just going behind the ear. That is mastoid process. Okay, so insertion, lateral surface of the mastoid process. Not only that, like when I was discussing scalp, I have shown you nuchal lines, isn't it? So lateral half of the superior nuchal line of the occipital bone is the point of insertion. So this is our sternocleidomastoid, very clear picture. Sternal head is coming from manubrium of the sternum, and clavicular head is coming from the medial one third of the anterior surface of the clavicle. So this is mastoid process, and this blue line is the superior nuchal line. Okay. So this is actually not required. Actually, this picture was also actually when I was discussing thyroid gland in yesterday or day before yesterday's class. I told you like we have two tubes, like one is trachea and the other is esophagus. Then we have certain muscles no, on either side. What are those? The same picture is here now. We have sternocleidomastoid. Okay, we have sternothyroid, thyrohyoid, omohyoid. Okay, all around we have trapezius behind. Okay, so platysma will be seen in front. Now, why I'm showing you this picture again is the important area like we have here carotid sheath with its contents. Okay, what do we see inside? What is carotid sheath? Condensation of deep fascia of neck is nothing but carotid sheath. So in the carotid sheath,
Yes.
medially, the common carotid artery, which is written as CCA, laterally it is internal jugular vein. Okay, then posteriorly we have vagus nerve, anteriorly we have ansa cervicalis. These are all back muscles which we are seeing behind. You need not know the names of these back muscles. Now see behind, this is our sternocleidomastoid outline. So behind sternocleidomastoid, this bluish area, whatever we are seeing is the posterior
Yes.
triangle. Now, when you start talking about posterior triangle, we should know. Now, still we are dealing with sternocleidomastoid only, but any muscle can come as an essay also. So suppose if this muscle is coming as an essay or whatever, 5 marks are short or very short. So suppose if it is much elaborated, then we should know the relations of this muscle also. So superficially, this sternocleidomastoid is related to skin, superficial fascia, the muscle what we see in the neck region, like just below the skin is
Yeah.
platysma, and then we have deep fascia. So deep, like suppose once you remove this sternocleidomastoid, in the deep part of the sternocleidomastoid, we will see, I will show all these muscles as we proceed. For now, you just try to remember the names. Superior belly of omohyoid, posterior belly of digastric. Okay,
Yes.
just a minute.
Mm. Yeah. Yes.
So the relations what we have further are, see anteriorly, I will show all these structures, you need not worry. Transverse cervical cutaneous nerve, posteriorly we will have accessory nerve. Accessory nerve is 11th cranial nerve and we have lesser occipital nerve. Now the blood supply of sternocleidomastoid, you don't read anything like this, better you just think over whatever we have read till now in head and neck. Always you should develop logical thinking, because by hearting will make you weak. So we know like external carotid artery is here. We know all the structures in head and neck are supplied by external carotid artery. So what are the branches which we have studied? Four
Yes, sir.
branches we have studied. The same four branches, if you remember, you can write. Like we have superior thyroid artery, isn't it? We have maxillary artery, we have superficial temporal artery, we have lingual arteries. So apart from that, many other branches will be there which are actually supplying sternocleidomastoid. If you write four also, that is more than enough. See, so occipital artery, posterior auricular, superior thyroid, suprascapular, whatever arteries are there nearby, they are all supplying sternocleidomastoid. So you need not worry. The nerve supply, see, I told you we see posterior triangle, 11th cranial nerve is visible there. So that is accessory nerve. This is also essay question I will discuss now after I finish this. So accessory nerve, which is a motor nerve, and we are finding this is like actually accessory nerve will have two parts, cranial part and spinal part. So in the posterior triangle we will be seeing the cranial part, sorry, the spinal part of the accessory nerve. Okay, we know pretty well now what is proprioception, studying muscle spindle. So that means the position sense of sternocleidomastoid and trapezius is actually perceived by the muscle, by this nerve, spinal part of accessory nerve. Now, actions of sternocleidomastoid. So suppose, if, what is this muscle doing? It is when we turn the head towards the opposite side, this muscle is contracting. That means it pulls the head to the same
Yes.
shoulder, and if you just flex both the muscles at a time, best example is when you are trying to lift your head from the pillow when you get up from the bed. That is the best example when you do bilateral. Okay, then if there is sometimes you will see like in small children
Yes, sir.
see a rhinitis, isn't it? A clinical condition where head is bent to one side,
No.
chin points to the opposite side. This occurs due to spasm of sternocleidomastoid muscle and trapezius muscle.
Mm.
Both are supplied by,
Yes, sir.
okay, sternocleidomastoid is this and trapezius is this, and this both muscles are supplied by spinal accessory nerve. If this nerve gets irritated, there will be pain and spasm in the neck region. So that condition is called as
Yes, sir.
rhinic. Okay, that is rhinic. Then spasmodic torticollis is characterized by repeated painful contractions of trapezius
Okay.
and sternocleidomastoid muscles of one side. Okay, it may be due to exposure to cold or maladjustment of pillow during sleep. That also may cause spasmodic torticollis. Okay, reflex is due to the irritation of spinal nerve, which may be sometimes due to birth injury also. Okay, but it is only temporary and it is very much treatable. Okay. Sometimes there may be tumors in this sternocleidomastoid muscle. You call it as sternomastoid tumors. Okay. So once, I hope sternocleidomastoid muscle is very clear. So once we are done with the sternocleidomastoid, we will now move to posterior triangle, which has now come as an essay question. No, you don't read anything. Just look at this picture better. Automatically, you will understand anything, everything. See, this is sternocleidomastoid. Behind sternocleidomastoid, whatever space we are finding, that is posterior triangle. So anteriorly, it is bound by posterior border of sternocleidomastoid, and behind it is bound by anterior border of trapezius. Okay, base is middle one third of the clavicle. This one better, middle one third of the clavicle, and apex is meeting point of sternocleidomastoid and trapezius. Hope this is clear. Niharika, understanding?
Yes, ma'am.
Okay, then see here, I was continuously telling you in the neck, as soon as we reflect the skin, we have a subcutaneous muscle, that is platysma, which forms the roof. See, sternocleidomastoid is intact, trapezius is intact. You are now in the roof of this area, beta. So in the roof, that means you imagine as though you are doing dissection. So that means first of all, you have to cut the skin. Once you cut the skin, you will have superficial fascia below which you will have platysma muscle. Okay, this is all platysma muscle, and underneath this platysma, you are finding investing layer of deep cervical fascia. So all these structures, they take part in the formation of roof. Okay. Now suppose if platysma muscle is coming as a short note or very short note. So what should we write? From where is it originating? So it is coming from the deep fascia covering pectoralis major muscle. Pectoralis major muscle we see in the, when we are doing upper limb, but we see in the anterior thoracic cage, right in front you will see pectoralis major. So it starts from there. It also covers few fibers, also cover deltoid. Now you see here insertion. Where is it going? Lower margin of the body of the mandible. Some of them actually it blends like this and it moves into the face. It's a very clear picture. Our previous picture also you can see. So it is coming from pectoral fascia, from deltoid, it is moving up. So this is the body of mandible, this is the angle of mandible, this is the ramus of mandible. It is coming upwards and it is actually mixing with this muscle which is called as rhizorius. Rhizorius. Okay. So, so insertion goes to lower margin of the body of mandible. Some fibers blending with the muscle at the angle of the mouth, that is the rhizorius, it becomes. So below the chin, fibers interdigitate with the fibers of opposite side. See here. So this is right platysma which is moving on left side, which is left. This is left platysma moving towards right side, and they are interdigitating, isn't it? So that is they are interdigitating. So nerve supply of this platysma comes from cervical branch of facial nerve. In action, it depresses mandible and draws down the lower lip and angle of mouth. Okay, so this is actually platysma muscle which is very well developed in this person and he is contracting. Okay, so that means it's a sheet of muscle. We can ask the patient to clench the jaw firmly and we may see this muscle. Okay, actually in lower animals like in cows, buffaloes, you should have seen there will be one muscle which is hanging like this, like this, like this, just below the neck. That is actually platysma. In lower animals, it is very well developed because it their limbs do not work to just fly away the mosquitoes. No, we are using our limbs, but they do not. So for them, that's the reason platysma is very well developed in lower animals. Okay, but whereas it is degenerate muscles in human being unless we use it. So this picture is actually showing us many things in the transverse section of the neck. This picture also helps you to understand the relations of thyroid gland. In yesterday's class, thyroid gland, though this picture was there, but it was not very clear. See here, two tubes. I'm telling you repeatedly so that it should be something like by hearting. My class itself should be a long-term memory for you. See, this is trachea, this is esophagus. Right in front of that, we have thyroid gland. On each side of thyroid gland, what is this carotid sheath? What do we have inside carotid sheath? Common carotid artery, internal jugular vein, vagus nerve, isn't it? Then what are the muscles we see? Sternocleidomastoid. See, these are labeled here. Sternohyoid and sternothyroid. Then omohyoid. On each side, same muscles. Right side also same muscles. Left side also same muscles. This dotted one which is present just below black line. Actually, this whole black line is investing layer of deep cervical fascia, which is present all around the neck. Just below the investing layer of deep cervical fascia, what are we finding, beta? You're finding like some interrupted dotted lines. No, that is actually platysma muscle. Okay. Behind we find a trapezius. These are all muscles of the back of the neck which you need not memorize. What is present in front of this green line? This is prevertebral fascia. This green line is prevertebral fascia, beta. So right in front of prevertebral fascia, whatever is there, that is important. And this pink line actually is the investing layer of the deep cervical fascia. Black line is the superficial fascia. Okay. So this picture will come in many things, in fact. No. So we are still in the roof. So in the roof, we find many structures like you are finding nerves like cutaneous branches of cervical plexus. You are finding external jugular vein over here. Okay. Then they see. Now this is Vishram Singh's picture. You can practice the same picture. What are the structures piercing the roof of posterior triangle? You are seeing the boundaries. Sternocleidomastoid anteriorly, trapezius posteriorly, middle one third of the clavicle forming the base. Apex is the meeting point of sternocleidomastoid, trapezius. So in the roof, we are finding three nerves. What are those? Lesser occipital, great auricular and transverse cervical. Root value is also given. From the root value, we can make out like it is coming as a branch of cervical plexus. Apart from that, you are finding supraclavicular nerve. C3, C4 is the root value. External jugular vein. So these are the contents of the roof of posterior triangle. If you practice diagram, you don't read theory. Sincerely telling you, need not read theory. Learn diagrams, list out the labelings, whatever you find in the diagram. Those are the structures in roof. Enough. You will get full marks, I assure you. Now, structures, the same thing, whatever you have read here, beta, it's listed here. Okay. See, lesser occipital, great auricular, transverse cervical, supraclavicular nerves, external jugular vein. Okay. So, the first four nerves are the branches of cervical plexus, which I already told you. Okay. Then, now coming to the floor. So once you remove the roof, so there is a fascia which is covering the muscles of floor. Just now I have shown you that green line was indicating pre-vertebral layer of deep cervical fascia. Isn't it this green line, whatever I said? This is the pre-vertebral layer. So this, like if you remove this pre-vertebral layer, we will be able to see the floor muscles of the posterior triangle. So what are the floor muscles we have? So in the floor, see just look at this picture again, Vishram Singh's picture. You just write in your own words. The floor muscles are, see, semispinalis capitis, splenius capitis, levator scapulae, then scalenus medius. Okay. All these muscles are seen in the floor of the posterior triangle button. Okay. So many complicated things will be told. Don't worry. You need not go with all those things. Go with simpler things, whatever I am teaching you. Okay. Then, so different pictures. This is Netter's atlas. This is Datta's picture. Vishram Singh picture. You follow. That is more than enough. Now, this posterior triangle is further subdivided into two halves by the inferior belly of omohyoid. Okay, so inferior belly of omohyoid further divides the posterior triangle into two triangles. What are those? One is the subclavian triangle and the other is occipital triangle. Above this inferior belly of omohyoid, whatever we have is the occipital triangle. Below this inferior belly of omohyoid, whatever triangle is there, you call it as subclavian triangle, also called as supraclavicular triangle. Whatever above clavicle, no, that's why you call it as supraclavicular. Whichever name is easy for you, you can follow that. Okay. So which muscle is dividing posterior triangle into two parts? Inferior belly of omohyoid. This is superior belly of omohyoid, which we see in anterior triangle. We are not bothered about it. This is the inferior belly of omohyoid. Above we have occipital triangle. Below we have subclavian, also called as supraclavicular. Okay, homoclavicular also. Whichever is easy name you can remember. So subdivisions, theoretically it is written inferior belly of omohyoid divides it into occipital and the supraclavicular triangles. Okay. Now, when you talk about occipital triangle, so what are the boundaries? But you need not read anything. You can hide with your hand. And you just think, see anteriorly, what are the findings? Sternocleidomastoid. Behind, anterior border of trapezius. Below, inferior belly of omohyoid. These are the boundaries of which triangle? Occipital triangle. This is our occipital triangle. Can you name this nerve supplying the sternocleidomastoid trapezius? Yes, that is spinal part of accessory. Okay. So the muscles which are seen in the floor, I am showing you like splenius capitis. So this muscle can be better viewed when you see it from behind. This is the skull bone where we have lambdoid suture, no, coronal and lambdoid suture. Here we will have the nuchal lines. This is the superior nuchal line. At this point, we can see certain muscles which come to form the floor. Those are the splenius capitis. Okay. We see the levator scapulae also in the floor. Okay. Then we will see the nerve supply of these muscles is dorsal scapular nerve. I just kept these many slides to make you understand, like these are the scalene muscles which are seen in the floor of the posterior triangle. Okay. So in front we have scalenus anterior, middle we have scalenus medius, behind we have scalenus posterior. So this is anterior view because you are finding arch of aorta, we are finding brachiocephalic vein. Okay, rest of the muscles you saw from posterior view much clear. Okay, so all these are actually muscles which I have shown you are making the floor of posterior triangle. Now coming to the contents are, what are we finding? We are finding nerves, we are finding trunks of brachial plexus, we are finding veins, arteries, isn't it? So this is little complicated picture, I will not tell you. It's better. See, contents of occipital triangle. Actually, if you are following Chaurasia, actually there is one table given better, which simplifies your learning like anything. Okay, you can download the soft copy if you do not have the hard copy of the book. So posterior triangle table, or if anybody has right now, they can share the table. So the
Yes,
table
ma'am.
gives, please better, half the table shows occipital triangle, half the table shows subclavian triangle. You learn it by heart and give the list enough. Your 15 marks are in your hand. Draw proper diagrams, okay, because it is an essay question. So don't think like question which has been asked will not be asked, because many times out of my previous experience I have seen many times questions have been repeated back to back. Okay, out
Ma'am,
of
should I share?
15 years experience I'm telling you. So don't take it for granted. Array, this was asked, chalo, leave it. No, you read it thoroughly. Okay, beta. So what are the things we find here? Spinal part of.
Ma'am,
Yes, beta. Would you like to share?
shall
Yeah, please.
yes, ma'am.
Yeah. Should I stop sharing? I stopped sharing, beta. Very easy way to remember the things. See, occipital triangle, we have list of nerves, spinal accessory, four cutaneous branches of cervical plexus, lesser occipital, great auricular, anterior cutaneous nerve of neck and supraclavicular. We have muscular branches, two small branches of levator scapulae and two small branches of trapezius and nerve to rhomboids, isn't it? Then we have the arteries, blood vessels we see here, transverse cervical artery and occipital artery. We have certain lymph nodes also which are seen along the posterior border of sternocleidomastoid, the supraclavicular nodes and the occipital nodes. So these are the contents in occipital triangle. In subclavian triangle, we have roots and trunks of brachial plexus, nerve to serratus anterior, that is also called as long thoracic nerve, nerve to subclavius, suprascapular nerve, and the vessels are third part of subclavian artery and vein, suprascapular artery and vein, then commencement of transverse cervical artery and termination of corresponding vein, lower part of external jugular vein, and few members of supraclavicular chain. Okay, so you please practice this. I'm just stopping beta so that I will share my PowerPoint now. So whatever things you have seen in the form of table, it has been elaborated here. So much of elaboration is also not required. We can skip so many things in fact. Okay. So this is also, I think it is Vishram Singh's simple picture. You have the list of all nerves here, spinal accessory nerve. Okay. So actually this point, like posterior border of the sternocleidomastoid in the middle one third, it is actually called as nerve point of the neck, because we have all nerves coming from here. If we want to give any anesthesia when we are performing the surgery in the neck, we can give blocking agent here. Okay. So subclavian triangle is also called as supraclavicular. So what are the boundaries we have? Superiorly it is inferior belly of omohyoid. Inferiorly it is middle one third of the clavicle. Front is lower part of the, like sternocleidomastoid, its posterior border, isn't it? Roof Same thing, skin, superficial fascia, platysma, investing layer of deep cervical fascia. This is our inferior belly of omohyoid. So what are we seeing in the floor? We are finding scalenus medius, this one, and this is scalenus anterior. It is labeled here, scalenus medius, scalenus anterior. Okay, so these are the muscles, and contents are, you are finding the trunks of brachial plexus. Your same thing was given in the table what like Niharika has just shared with us. You are finding only the pictures over here. Transverse cervical artery, you are finding corresponding vein, you are finding suprascapular artery, you are finding corresponding vein, we are finding. Okay, so all those things, deep cervical lymph nodes, whatever you have studied is only shown here. Okay. All these are not required, but it becomes. See, external jugular vein, it has come as a short note, no, when we did one of the papers. So external jugular vein begins just behind the angle of the mandible by the union of posterior auricular vein with posterior division of retromandibular vein. This is our external jugular vein, isn't it? See, this is external jugular vein. Finally, it drains into subclavian vein. Okay. So external jugular vein, if question is asked, you can write the tributaries better. What are the various veins which are opening? So you are finding posterior auricular vein, isn't it? We are finding posterior division of retromandibular vein, transverse cervical vein, suprascapular vein, anterior jugular vein, posterior external jugular vein. So all these enough beta. So like how many? We are giving 6 veins which are draining into external jugular vein. Okay. So these 6 veins you just try to remember. All these are not required, but if it comes, then I will take this. It didn't even come anytime, so I don't want to trouble you. So what are the lymph nodes we see in the posterior triangle? See, this is sternocleidomastoid. So along the posterior margin of the sternocleidomastoid, we are finding round, 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 round. All these are nodes. And between these nodes, whatever we have, these are lymphatic vessels. So inside the lymphatic vessels, lymph will be flowing, which is a fluid, whereas lymph nodes will take up the job of killing the microorganisms. Okay. So applied aspects, we have torticollis, that is Rhineck. Okay. And then pulsations of subclavian artery can be felt like at the root of the neck by pressing behind the clavicle. Okay. Swelling in the posterior triangle, it may be due to enlarged lymph nodes, or it may be due to tuberculosis, it may be due to Hodgkin's disease, okay, or it may be due to cancer, breast cancer, or anything like cancer which is seen in the arm or chest region. Okay. So, so like